Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. Let's talk about wrist pain, so stay tuned. Thanks for watching. Let's talk about wrist pain. Listen, not every wrist pain is actually a carpal tunnel, so let's be careful with that. Let's talk about carpal tunnel first and see what that even means. So you've got this tunnel right here in your wrist where a whole bunch of soft tissue, including your median nerve, that go through. Carpal tunnel is the irritation of that median nerve because of many things. You have to understand some very basic concepts. Not every carpal tunnel symptoms is actually a median nerve issue. So you can have the symptoms, but not necessarily caused by it. So if you have pain in your wrist and into your fingers, it's not necessarily always carpal tunnel. And then the way nature has intended it, you actually have a bracelet of membrane that covers all the structures here. So surgically, they go and snip that bracelet as if that's going to help. Well, it helps for some people, but not long lasting. So you need to understand what caused the irritation of the tissues here. For one, in my practice, I see more of a pain radiating to the wrist and to the hands that are not necessarily nerve issues. They come from your forearm. I've done a video on this very subject, so search for that after this. Now you have to understand when it comes to pain in the wrist and the hands, which almost every case in my practice is a misdiagnosis of carpal tunnel syndrome. After I do active release on the muscles here, which have to do with rotation, like supination, pronation type, this kind of movement, as well as flexion and extension, I basically condition the muscles of the forearm. Then I actually, my practice, go through and pull the wrist joint, do the distraction within the joint, and then just with a slight distraction, I basically go through circumduction and movement of the wrist. Many times there's like a little clicking. It's like an adjustment of the wrist. I'm not showing you how to adjust the wrist necessarily, but I'm just telling you a distraction and going through careful movement of it many times provides relief. And then I actually tape the area, because so many times when things are misaligned and irritated, you need that extra support until the tissue is healed. So this is the time that you want to up your protein intake. Of course, if you have gout, then that's something to be concerned about, because excess protein causes an inflammation or irritation or exacerbation, that's the word, exacerbation of your gout. But typically the tissue needs excess vitamin C or extra vitamin C and extra protein to repair it. So I tape the area to provide some support. I do the distraction of the joint after I condition the forearm. Hope that this information helped you. I've been seeing a lot of wrist issues these days, and with the developmental kinesiology that we do in the office, I see that many times we have to go back and condition the wrist itself before we can work on the posture and the movement pattern that the patient has. You have to understand we are resuming a lifestyle, sedentary lifestyle, that is so much in conflict to what our body is designed to do, and all of these are conditions that we see as a result of this conflict. Anyway, I hope this helped you. Please make sure you subscribe to my YouTube channel for a lot more videos and more videos to come. That way you get notified, and follow me on my Facebook page, Irvine Spinal Wellness Center. You take care.